Good evening and welcome to this webinar where we will present the latest EuroTrak survey results. I'm Dominique Jaspers, President of UCBA CEUPA. UCBA CEUPA is the umbrella organization representing the 6 professional associations of hearing aid specialists and audiologists in Belgium. Since our founding in 1989, we have been committed to promoting high-quality hearing care, supporting our professionals, and representing a strong voice to government and partners across the healthcare network. A key focus of our work is fostering close and constructive collaboration between audiologists and ENT specialists. Audiologists are active not only in ear, nose, and throat departments in hospitals, polyclinics, and private practices, but also in rehabilitation centers, multidisciplinary centers, special education, home guidance services, and hearing care industry. This broad involvement makes audiologists an essential link in multidisciplinary hearing and balance care, always working complementarily and in dialogue with ENT specialists in the best interest of the patient. I would now like to introduce Dr. Dussen, ENT, who will moderate this evening's sessions. Thank you, Dr. Dussen, and over to you.
Thank you, Mrs. Jaspers. Good evening, ladies and gentlemen, dear colleagues. We are pleased to present to you the results of the EuroTrak study 2025 for Belgium tonight. EuroTrak, launched by EHIMA in 2009, is the largest international study on hearing loss and hearing aid news. Its goal is to increase public awareness of hearing health and the importance of professional hearing care. Conducted every 3 years by ANOVUM, the study examines the prevalence of hearing loss, the use of hearing aids, and user experiences. EuroTrak provides valuable insights and comparisons across countries and continents. This webinar is split in 2 parts. We will first begin with Dr. Stefan Zimmer, and then we will pursue with Mr. Mark Lorenz. Dr. Stefan Zimmer has been EHIMA Secretary General since 2017 and Chairman of the German Hearing Industry Association since 2015. Previously, he served as General Manager of a Chamber of Commerce for small and medium-sized enterprises, where he became closely involved with the hearing sector. From 2006 to 2011, Dr. Zimmer was responsible for international relations at the German Social Accident Insurance, leading work on European and global health, safety, and prevention policies. So, just before leaving the floor to Dr. Zimmer, I would like to remind you to post your question to Dr. Zimmer and Mr. Lorenz in the Q&A chat box. Our orators will answer them at the end of the 2 presentations. We are now listening to you, Dr. Zimmer.
Thank you very much, Dr. Dussen. And thank you also very much, dear Dominique Jaspers and UCBA CEUPA, for the invitation to be able to speak at this webinar about EuroTrak, about Belgium in the European context. And I want to share with you some insights gained from the EuroTrak survey in Belgium and in other countries, and embed the Belgian findings into a set of data that we sampled from various other European countries. I want to focus on a very important aspect that is linked to hearing health and hearing care and untreated hearing loss, which is productivity, labor and job retainment of people. And based on this sample of 9 countries, we're going to want to look at the background of the labor shortages that is ongoing in Europe these days. We're going to have a look at the link between hearing care and health, focus on 3 specificities: fall, stress, and mobility. And then we want to ask the question, is there anything that hearing care can contribute to raising productivity? As I said, 9 countries. Wherever you see this little symbol in the upper right corner of the slide, you know that the data I'm referring to is taken from the sample of 9 countries, those countries being Belgium, Germany, Portugal, Poland, Spain, Denmark, France, Italy, and the Netherlands. A sample of more than 130,000 people who were asked about their hearing status and if they use hearing aids, why, how long, how satisfied are they with them. And if they do not use hearing aids, we ask those people, why not? And I'm sure Mark, in the second part, will go into the observations that are very interesting when concentrating on Belgium. Now, the hearing loss prevalence, meaning the percentage of people that self-assess to have hearing loss, varies between the upper 9 to somewhere around 12% in Europe. Belgium is pretty much in the middle of it with 10%. And this prevalence is relatively stable over time. And as Dr. Duchesne said, we've been conducting these surveys since 2009. Well, we're quite happy to state that the hearing aid adoption, the rate of people who have hearing loss and use hearing aids, is rising throughout the years. We see a wide discrepancy between 23% in Portugal up to the mid-50s in Denmark and France. And here, Belgium, incidentally, is the median value with 41% of hard of hearing people actually using hearing aids. The uptake overall is growing. If you're interested, not only in this pooled data, but in the various country surveys we've done since 2009, please have a look at www.ehima.com/surveys, where you can find the roughly 60 surveys we've done so far in 18 countries with close to 900,000 people being surveyed, not only in Europe, but abroad as well. Now, adoption, as I said, Belgium pretty much in the middle of it with 41%. It's interesting to note that adoption seems to be closely linked to another aspect, which is reimbursement. Wherever we see high levels of reimbursement of hearing care, be it by mutualities, any other health insurance, or even the government, the state, as is the case in Denmark or in the UK, there, of course, adoption is relatively high, whereas where there's no or only very little reimbursement, the adoption tends to be very low. Regardless of the adoption level, regardless of the amount of reimbursement people are granted, what we see in all countries surveyed, not only in those that have been pooled, is that the satisfaction rate with the product and the perceived quality of life is very high. More than 90% of people we asked are claiming to have a better quality of life after being fitted with hearing aids, whether they have received any money or only little money from third parties or not. Also, the satisfaction with the product itself, with the technology, with the hearing instrument is very high, very stable, around 80+%. Now, why is it that only 23% in Portugal, 41% in Belgium are actually using hearing aids of those people who claim to have a hearing loss? Well, first of all, people who claim to have a hearing loss have not necessarily been diagnosed by you, the people in the audience, the professionals, the ENT doctors. That's one thing. Another thing is that a significant percentage of people claiming to live with hearing loss do not even seek a diagnosis. They don't even knock on your doors. Up to 30% in the countries we surveyed do not come by an ENT doctor to clarify what their actual hearing condition is, what the reason is behind it, what kind of hearing loss they have. And only if this, of course, has been diagnosed, any treatment can be prescribed or suggested. That's a significant share, up to 30%. And that's something I think together the industry, audiologists like UCBA, CEUPA, and you, the professionals, the ENT doctors, can do something about by enlightening the public to, once they have the feeling of having hearing loss, make sure what the reason is behind it, whether it's a clogged ear or something to be taken more serious than that. Of course, not every diagnosis of those who actually come to an ENT doctor leads to hearing aid therapy. It's a different kind of hearing loss, or it's not worth being treated, many other reasons. But interestingly enough, up to 49% of the people who receive, let's say, prescription to get hearing instruments do not obtain those, despite the professional recommendation of their doctor. Up to 49% say, okay, well, obviously there is need and good reason for me to be fitted with hearing aids, but I'm not going to do anything about it. That also, together with those 30% on top, is something that's a certain bottleneck that we can do something about, and we should. Why? Well, one reason, other than all the health benefits associated with taking care of your hearing, is an economic reason. We see, and the newspapers and the media are reporting on it, about it on a regular basis, the working age population in the European Union is shrinking. We, at the same time, witness that adults who live with hearing loss, untreated hearing loss that is, have increased odds of unemployment or underemployment. In fact, a smaller percentage of people living with hearing loss is actually in employment compared to the general population. And all of this comes with a price tag. 55 billion euro is the annual price tag to the European Union, for the European Union, for lost productivity due to higher unemployment among individuals who live with disabling hearing loss. Shrinking working age population, increased odds of unemployment for people with untreated hearing loss, in fact, a smaller share of hard of hearing people being in employment, and at the same time, a lost productivity invoice of 55 billion euro per year. I'm not saying that this trend, be it the aging population, the shrinking workforce, the fact that untreated hearing loss is linked to underemployment, can be totally reversed just by fitting everyone with hearing aids and undergoing professional hearing care. That would be highly naive and presumptuous. Of course, that's not the case, but I'm fairly certain that together, the stakeholders involved in hearing care, manufacturers, audiologists, ENT doctors, can raise more awareness about the importance of being treated for hearing loss. So if not a total reversal of this trend, there are many factors playing a role here, of course, maybe we can remedy it to a certain extent. First of all, let's have a look at the connections that many of your patients might still be unaware of untreated hearing loss and other health risks. You know all of that. Let's just sum it up by saying there's a link between the hearing system and the balance system. Now, knowing all of this, we see that slips, trips, and falls are, speaking about employment in the European Union, the second highest cause for fatal and non-fatal workplace injuries in Europe. The likelihood of falls increases with age. And untreated hearing loss can increase the risk of falls by up to 30%. The more severe the hearing loss, the more likely the chances to actually fall. Studies have found that using hearing aids can reduce the risk of falling by 50%. So, knowing that slips, trips, and falls are the second highest cause of workplace accidents in Europe, maybe it's worthwhile to highlight the link between untreated hearing loss and the potential prevention of those fall accidents to keep the workforce healthy and safe and in employment. Another aspect that, thanks to EuroTrak, we collect data on year over year in many countries, and this goes along with the trend in the rest of the world that we do these surveys. There's a link between physical stress and untreated hearing loss, because 57% of people living with untreated hearing loss, so without hearing instruments, often feel physically exhausted in the evening, opposed to 37% of people using hearing aids. Well, why is that? strain, muscular strain, maybe neck pain, because, you know, listening also becomes very tiring on the muscles and your joints, maybe, if you do this throughout the day and if you're not just in a relaxed position to listen and understand other people. Same goes with mental stress. 48% of people living with untreated hearing loss claim to often feel mentally exhausted in the evening, vis-a-vis only 30% of people using hearing aids. Well, of course, there's less strain on the brain. It's easier to follow discussions, to concentrate on the relevant things, on content, because the brain is not busy trying to figure out, okay, what exactly has the other person just said now? Can I still read from his or her lips? And fill in the blanks. Mobility, interesting aspect that also has shows a connection to hearing loss. According to the European Agency for Safety and Health at Work, the journey to the workplace and from the workplace is the most hazardous part of the workday for many, many people, especially office workers. What does that have to do with hearing loss, you might ask? Well, we asked people who have been fitted with hearing aids what their perceived sense of safety and confidence is in traffic. And 72% in the pool of countries said that they feel more confident now moving in a city after having been fitted with hearing aids, 70% in Belgium. 73% more confident and safe driving a car, 75% more confident and safe riding a bike than before. That definitely contributes to reducing commuting accidents, thus playing into higher productivity and employability of people. There's one example of a European Union country, namely Italy, that I want to highlight here. In Italy, since 2024, when the law was changed, it still has to be put into practice, but at least the legal requirement have been changed. Since 2024, every Italian citizen who wants to obtain a driver's license or renew his or her driver's license has to undergo an instrumental hearing check, meaning a hearing test with instruments, like in an ENT practice. The reason behind this is not to discriminate people hard of hearing, saying, okay, you have a hearing loss of around, 45, 50 dB, you can't drive, or only up to 80 kilometers per hour. Of course, that's nonsense. That wouldn't be the case. The goal is to make people familiar with their hearing status, to make them aware of their actual hearing status. Because once they know they are hard of hearing and it has been measured, they can choose whether to ignore it or at least adapt the way they're driving. Oh, I don't hear that. I don't hear that well. Maybe I should be a bit more careful. Or ideally, seek treatment. So this is an easy way to enlighten people to raise awareness without discriminating against them. Actually, the hearing industry also promotes safety and confidence for people commuting. Every one of us who's been not only to Brussels main station or so and trying to follow the loudspeaker information has had a hard time in almost any train station in the world. It's hard to understand what has been said, where exactly my train is coming, why it is delayed. It's hard to understand that. This is why about 12 years ago by now, the engineers from members of EHIMA, together with the Bluetooth Special Interest Group, joined forces to develop a new Bluetooth standard. It's called Auracast Broadcast Audio. It's a new Bluetooth standard allowing that an audio signal can be streamed from one device, one loudspeaker, one streamer, in a train station, house of worship, movie theater, concert hall, conference center, airport, to many Auracast-capable hearing devices at the same time. It's a broadcast device. So people can get the announcements directly in their hearing aids or in their Bluetooth-enabled in-ear devices or headphones. So whether at the train station or at an airport, you get the information directly in your hearing device if and why your train is delayed, or if there has been a a gate change at an airport. In January 2026, Auracast broadcast audio has been installed at Frankfurt Airport, a major hub in Europe. As you know, the first gates have been fitted. So you don't have to stick around that particular airport gate and wait. If there's a loudspeaker announcement, you can walk around. Be sure that the announcement of any change or boarding information will be streamed on your devices. Final point, hearing care and productivity. We talked about general health issues, prevention of slips, trips, and falls, stress, physical and mental. We had a quick glance at the potential impact of hearing care for mobility of workers to and from their job. Then we asked people themselves, right to the point, do you think that your hearing aids, now that they've been fitted, are useful on your job? And 67% said they're even of significant use. And only 7% said, nah, basically not. They're not. So that means that 93% of employees living with hearing loss, having been fitted with hearing aids, say that they're highly useful or they're useful on their job. 96% in Belgium, a pretty high score, by the way. Why are they useful, hearing instruments? Well, the perceived success rate at work is higher. The relationships at work are better. Well, no wonder, finally, it's not that hard to participate in group discussions at the water cooler or the coffee machine. The sense of safety is higher. We talked about that. And the overall participation in group activities is more likely because it's just easier to participate again. A new question we started asking in the 2025 round of EuroTrak surveys, so only in a few countries so far, is, do you believe that due to your hearing aid provision, you can be employed longer than without hearing aids? And regularly more than 50% said, yes, that's the case. Germany, Italy, and Belgium as well. As I recently mentioned at another presentation, France is a bit lower than that. I was commenting that maybe in France, more people at the age of 55 are already in retirement. So that question is not applicable to them. But of course, that's not the case. But I don't know, there must be some reason why in France people do not expect to work longer using hearing aids, but in the other countries it's significantly higher. Well, it may be tricky to ask this question to a Belgian audience, but each of you might have an idea why that is the case. Not for me to comment. Now let's conclude. So we have enough time for questions and answers at the very end, and Mark surely needs some time for his presentation. We've had a quick glance at how untreated hearing loss is linked to increased odds of unemployment, higher risks to general health, lower levels of job satisfaction, maybe earlier retirement. We've seen that the loss of productivity can even be quantified in euros 55 billion per year, which leads to growing costs for societies at large. If we leave this process unattained, if we just let it go, working age population shrinking, getting older, and people hard of hearing less likely to be employed. Raising hearing health awareness, addressing those 20-something percent of people who claim to have a hearing loss but are not even willing to consult an ENT doctor about it. Addressing those 30-something percent of people, in some countries even more, who despite having gotten a recommendation to get professional hearing care and hearing aids, but not willing to do anything about it. Raising awareness of these people is something that is called for. They need to go and get their hearing screened rather often, on a regular basis, ideally. They should seek early diagnosis because they need to know about the link between hearing loss and all the other risks, not only to their personal health, but in general and to society at large. Some people still think hearing loss is just something that makes life a tad more difficult, but is highly manageable. And there are more important things than that. I think we should help people to understand that's not necessarily the case, and they need to know what the benefits of professional hearing care are. Those people who finally have been fitted with hearing aids, in hindsight, claim that their quality of life is higher since they have been fitted, and they regret not having been fitted earlier. 62%, and in Belgium, specifically 59% of people say, well, had I known how useful hearing aids are administered by professional audiologists, I should have, and I would have gotten them earlier. I wouldn't have missed out on social life. My mental and emotional health would have been better. My performance at work would have been higher, and I would have felt less fatigue in the evening. That's a story that people who use hearing aids say. It's not an industry marketing claim, and therefore highly credible. And I think it should be communicated by all of us, audiologists, ENT doctors, industry, all stakeholders, patient advocates, all stakeholders in hearing care. And with this, thank you very much for your attention. I leave it at that, and I guess hand over back to Dr. Toussaint.
Yes. Thanks a lot, Dr. Zimmer, for your presentation. We have now all the keys to raise awareness towards our patients. So, dear participants, as already mentioned, please do not hesitate to post your question in the Q&A chat box to feed our Q&A session, which is going to take place just after Mark Lawrence's presentation. So, now we have Mark Lawrence. He's audiologist, the president of the European Association of Hearing Aid Professionals, the vice president of UCBA CEUPA, a board member of BAudio, a dynamic member of the World Hearing Forum and the WHO Make Listening Safe initiative and workstream. He is also a lecturer in hearing aid fitting at the Thomas More University College in Antwerp. And finally, he is director of the Amplifon Center for Research and Studies in Milan. He is going to present reflections about the Belgian hearing care in light of the EuroTrak study results.
So I hope now everybody can see my screen. Thank you so much, Dr. Toussaint, for this introduction. And thank you, Stefan, for introducing EuroTrak. So that helps us a lot. We don't have to go to all the details right now. So that seems to be a good plan. Okay, let's talk about Belgian hearing care in European perspective. And of course, using EuroTrak as the basic information. When you look at EuroTrak in Belgium, in total, there were 15,000 people who have been surveyed, of which 1,270 had hearing problems, and of which 543 was using hearing aids. I will compare to more countries in Europe. So you will see that in this case, I will compare to 12 countries, and you see them all listed here. So I think I was so kind to include also UK. Even after Brexit, we want to see them, and Switzerland, some other countries are joining, which means that we are talking in total about 173,000 people who have been surveyed, 15,000 people reporting hearing problems, and 6,790 hearing aid users. We will compare to the rest of Europe, and when you see this, Belgium is doing worse than Europe. When you see this, Belgium is doing average, and if you see this, Belgium is doing better. So that's the whole plan. Now, what about the percentage of the total population reporting, self-reporting hearing problems? That's 9.4%. So you see that Belgium is slightly under the European average. And here you see the list of all the countries. We see that Italy has the highest percentage, but that could be explained by the fact that also Italy has one of the oldest populations in the countries surveyed, right? That's what you see here. Now, if you, of course, we know, and I'm preaching to the choir, we know that if you look at the trend of reported hearing loss per age group, then you see that Belgium is kind of following the logic you see in the rest of Europe, maybe slightly lower for 65 if you look at this. But we know that the big chunk is the 65 plus population. That is the biggest group of people reporting hearing problems, and also most likely the biggest group of people using hearing aids. Now, where are we in Europe, and what about this percentage? In 1980, 12% of the total population in Europe was over 65. In 2025, so around this period, it's already 21%. And if you look at the projection, this will increase until 2057, where it will rise to 30%. So that 65 plus group is growing in Europe. What about Belgium? Well, in Belgium, we were already 14% in 1980, so slightly higher than Europe. We are at 17% right now, but you will see it will keep on rising. It looks like in Belgium it will keep on rising until 2088, where 32% of the Belgian population will be 65 and older. We know it's an issue for the healthcare system, but we also know that all of us, the ENTs, the audiologists, will have a lot of work coping with this big group where we expect that they will need our services and our care for hearing. What about the uptake of hearing aids, right? So it's people that are self-reporting hearing problems. And as Stefan so clearly said, when you say that you are having hearing problems, it doesn't always mean that you need hearing aids. And you also see that in the UK and Denmark and that where hearing aids are totally free of charge, the highest uptake is around 50%. So that's about the highest you get, even in countries where hearing aids are completely free of charge. Still, we are slightly under the European average. You could say, Stefan said we were in the medium, but remember, I included more countries, and one of them is the UK, where the uptake is very high. So that is explaining it. If you want to get more information on all of this, we do have a joint publication, EHIMA, European Federation of Hard of Hearing People, and EHIMA, on getting the numbers right, where we analyze these results and look at trends. And what you see in the latest report is that the uptake of hearing aids is growing in all European countries. So here you see, and for the UK, France is growing very rapidly with the 100% Santé. Here you see Germany growing, here you see Italy growing, and here you see Belgium growing. So the uptake of hearing aids in Belgium is growing. So there's a trend that more and more people are using hearing aids, percentage of total people reporting hearing loss. Now, what about this dropout, and what about people visiting a doctor because of their hearing problems? And you see that Belgium is doing better than what was presented just now. So and if you look at this trend, over the last 8 years, we saw an increase of more than 4% of people visiting a doctor because of hearing problems. In 2017, it was 70%, and now we're up to 75%. So only 25% don't visit a doctor. Why? Well, it should be better, but let's see, it's going in the right direction. And then when they visit the doctor, is a hearing aid, or hearing aids or cochlear implants recommended? And then you see there's a growth from 40% in 2017 to 53% in 2025. That is probably linked to the fact that there is a change in regulation. You needed a 40 dB hearing loss in 2017. In 2021, you also needed 40 dB, but then you also could get access to hearing care and to hearing aids if you were under 65, if you had problems understanding and noise. And in 2025, the average hearing loss you needed to get refunded for hearing aids is at that moment was dropped to 35. And we all listened to you, and we listened to the ENT societies, and you told us that as long as there is no reimbursement, it's very difficult for a doctor to propose to their patient to go for some kind of care because it doesn't feel very well. Now, what is good, and that's very high in Belgium compared to other countries, the moment you get a prescription, the uptake is very high. So you see if 53% is getting a referral, 41% in total is using hearing aids, which means that this is close to 80% of people getting a referral that actually goes and starts using hearing aids. So your role is very important, it's very convincing, and we see that the uptake is growing. So that is a very positive story. We also see it in the latest RECEIVE numbers. We requested the RECEIVE team to give us the split per age group of the uptake and refund for hearing aids. And here you see if you compare 2021 to 2024, then you see that in fact the median moved from 80 to 84, which was the highest group. This includes renewals, by the way, and this moved to 75, 79. So you see there's a trend in this direction, and we see a very interesting growth from 60 years onwards until 75, where you see a huge growth in the number of people going for hearing care and getting hearing aids or cochlear implants. Now, when we look at the uptake of people self-reporting mild hearing loss, then we see that Belgium is really behind. There we're only at 16% of people starting to use hearing aids, while at 21% is what you see in Europe. So the more positive way of saying there's a potential for growth, there's room for improvement. So that is something we need to take into account. And we do see a trend, because if you look at the average European uptake of hearing aids for people with mild hearing loss, it has been growing over the years. And also in Belgium, we do see a growth. So we see it's increasing. And that's, of course, because the move from the average 40 dB hearing loss that you needed before to 35, the fact that the signal-to-noise rule, people having problems understanding a noise, has been implemented. And now we are really fighting hard and trying to convince the government that this should also apply to all Belgians, not only the ones under 65, but hopefully also the ones over 65. Because if you have problems understanding a noise, it's clear that you need support and care. On binaural hearing aid fitting, Belgium is very high, and we know that. I think according to EuroTrak, it's at 79%. If you look at the latest year, if you look at the numbers for 2025, and we look at the reimbursement, we're even over 83% of people using binaural hearing aids. So that is a good sign, and that helps a lot. Are people satisfied with their hearing aids in Belgium? Yeah, Belgium is scoring very high. So we are second in rank if you look at all these countries. So good. 84% satisfaction. Hours of use, Belgium also second line. The Belgian hearing aid users use the hearing aids 9.5 hours per day. So that's a very high number. So that is very, very positive. And we know that there's a correlation between satisfaction and hours of use, which is not so surprising. What about hearing aids in the drawer? Because you always hear that, yeah, there's so many people having the hearing aids in the drawer. In Belgium, that is only 4% of people not using the hearing aids. So that is fairly okay if you look at compliance with other medication and stuff. 4% is still too much, so it should be 0 to be ideal. We all agree, but it's not that Belgium is scoring poor. I think we're doing quite a good job there. Now, of course, what about the audiologists? Here you see the campaign that we are running together, that UCBA CEUPA is running together with audiology educational settings in Belgium. And we know that audiologist is an invisible job. This young people don't know what audiology is, and we're promoting it. But what about the quality of the audiologist in Belgium? Did the investment in setting up good educational settings, a lot of bachelor degrees, master degrees, doctoral degrees in audiology, did it pay off? And what are we doing and how we are focusing? If you look at, are people satisfied with the quality of the service of their audiology during the fitting? We also see that here 90% is satisfied. Belgium is scoring very, very high. Are people satisfied with the service they get after purchase? So it's not that once you get a hearing aid and then leave it over. Yeah, there we see it's very positive. We see that 98% is very satisfied, meaning that we're also second rank. So good job. What about the professionalism? Also here we are scoring high. 89% is satisfied with the professional of their audiologist. And what about counseling? And counseling is very important. I keep saying the best skill of an audiologist is to able to listen to the user, listen to the people, and really inform and counsel them in a good way. By the way, that is why we have 2 ears and only 1 mouth. So we should listen double as much as we talk, but listen carefully, counseling them, guiding them, and motivating users to work better. And then, as you may have heard from Stefan Zimmer, also EuroTrak is doing a lot of work looking at the impact of hearing care on work, right? And I'm just showing you the Belgian results compared to the average. And you see that all countries in Europe, if we combine some use and significant use at work, we see that in every country, it's more than 90%, which is stating that, yes, their hearing aids are very useful at work. So that is a very positive sign and also quite important. But let's look a little critical on this. So we joined forces, so the European Association of Hearing Care Professionals, European Federation of Hard of Hearing People, and the Thomas More University College, the audiology department. We have launched a survey over more than 10 countries now. And so far we have 819 responses from hearing aid and cochlear implant users. The people responding, we wanted them to see how is it to work with hearing loss and hearing care using hearing aids and cochlear implants at work. You see the majority of those people had a pretty severe hearing loss. They start from moderately severe, severe, profound, and total hearing loss. So that's a big group. And when you ask them, Did your cochlear implants or your hearing aids really work and help you to hear better where you wanted to hear better? We see that there is an overall very positive response, right? Most of them say they helped moderately, quite a lot, or even very much. So that's good, both for hearing aids and for cochlear implants. So that's the good news. But we also see that people at the workplace, need accommodations. They need to be able to have assistive listening devices. They need to have captioning, instant messaging. They need to have different flexible work arrangements. They need to have good occupational health assessment, workplace adaptation. One of the examples is all these open plan offices don't work very well for people with hearing loss. There's too many people around. Give them a better acoustical environment, and also communication training, awareness, but also for colleagues. So we see that is important, and that really pays off and helps a lot. But the question is, who brings you that information? So if you have a hearing loss and you go for hearing care, you get your cochlear implants or you get your hearing aids, who informs you about the support you can get at work? Because Belgium has good systems in place. We have VDAB, we also have similar organizations in Brussels and in Wallonia, where you can get good support adaptation in the workplace. And there we see that 53% of the people responding to this survey were not informed at all, or they had to research it themselves, or they just didn't get any information, which is a shame. And what kind of disappointed us is that we see that hearing care professionals, audiologists, ENTs, that it's only 9% where they get the information from our side. And that is not because we are not willing to, because it seems that we are not always aware, not well informed, not well trained to do that. And here we really need to step up, and we want to do that. So please help us, because we have created this survey. It's a validated questionnaire, validated translations. It's available in Dutch and in French. So please help it and give this to your patients who are active at the workplace so they can inform us better. And we can pick this up and use this in the curriculum for the training of audiologists. We will be very happy to share it with you. We will be very happy to share it with employers and other stakeholders, but also with hard of hearing people. Since this is so important and we want to step up, this is also the main theme of the virtual spring symposium of the Belgian Society of Audiology, B-Audio. On the 2nd of April, 21st of April, and 23rd of April, we will have 3 evening sessions from 8 till 9:30. The first evening will be dedicated to what does the research say about the impact of hearing loss on employment. You will hear Cato Phillips from Antwerp and the Hear Again Work Again research. You will hear Adriana Zekveld from Amsterdam talking about their research. The second day, on Tuesday, you will hear Lydia Best and our results, and I will give the part on the survey, where we will show the results, the detailed results, what we can do and how we can do better. You will hear the personal story of Veska Peters. And then the third evening, you will hear Nicolai Basele from the VDAB, what kind of support is available, how you can access it, what is work. And Anke Heij, who is also hard of hearing, but she's really a very good supporter, training people, giving people the support they need to be empowered to make the difference at the work floor. So I strongly encourage you to be there. Please join us. I think it will be an interesting session, and it will prepare us to do better. For the conclusions, 9.4% of the Belgian population self-reports to have hearing problems. The percentage of the Belgian population over 65 years will increase from 17% today to 32% in 2088. So we all know we will have a lot of work to cope with this, but I'm sure we're all motivated to make the best out of it. The percentage of people with self-reported hearing problems consulting an ENT, referring to an audiologist and using hearing aids is growing. So it's going positive. So in Belgium, we are on track. So we shouldn't complain. It shouldn't be a negative story. No, things are going in the right direction. We can still improve. We are still somewhat under the European average, but the trend is positive. So we should keep moving into that direction. We do very well on binaural fitting, on satisfaction with hearing aids. The use per day is high. Satisfaction with audiology services and a low percentage of hearing aids in the drawer are very positive signs. But we do need to increase the percentage of people with self-reported hearing problems using hearing aids. So we still need to grow there, but there's good trends. And definitely we need to focus also for people with mild hearing problems. Did you know that people with mild hearing problems have the double odds of having issues at work, of being unemployed, or being so fatigued at the end of the day that they're no longer fit for work? So hearing loss is important. And then hearing loss over 35 dB average hearing loss is in fact tripling the risk at work. So there's really something we should do about this. So we need to step up. We need to inform hard of hearing people better. We need to empower them to be successful at the workplace. So please help us to promote the survey. Please come and join the We Audio Spring Symposium. And we're also developing IA in combination with EFO, a toolbox, a really package and toolbox to inform employers, to inform hard of hearing people, to inform hearing care professionals, audiologists and ENTs on what it takes, what is available and how it works. So let's join forces to make this even better. Thank you for your attention. And I'm sure together we can make a difference and empower people to develop to their full potential. Thank you so much.
Thanks a lot, Mark Lorenz, for this nice presentation. We will now go through the Q&A session. So maybe first we can begin with a question for Dr. Zimmer, but I think you already answered it in the chat box, but maybe do you want to add something about this?
Sure, thank you. Well, the question was, and it's a very good question, the question was basically, where are those people hard of hearing not showing up at work? I mean, who are they? Where are they? Like, and I just wanted to make clear by answering that it's a statistical observation that people hard of hearing with untreated hearing loss are less likely to be in employment. It's not that they refer to go to the job because commuting is too dangerous or group discussions are too strenuous. It's just that it might only be one of several factors that play a role here, of course, that they're less likely to be in work, maybe still in work when they grow older. They tend to seek earlier retirement more often than people who are not hard of hearing or who have had their hearing loss cared for, or maybe they're not at work. Also, these statistical observations are made by the WHO and by a very interesting study from 2019 by Brunel University in London. I'm happy to share with you or Dominique the slides where the sources of those statistical observations are also mentioned. So everyone, if you share them with the attendees, they can follow up and have a look at the studies in detail.
Thanks a lot for those precisions. So if there are other questions, please, it's still time to post them. I have another question from Mark Lorenz now. So in fact, there are 3 questions in one. So it is possible that in countries where there is more uptake of hearing aid, there is also a higher percentage of dissatisfied patients. So
I think that's a good question because we have seen, like in countries like in the UK and in Denmark, where hearing aids are totally free of charge, the uptake is high. And we do typically see that in those countries, satisfaction is somewhat lower. But that has multiple reasons. Like in the UK, hearing aids are delivered by the NHS. So you go to an NHS audiologist, you have a long waiting list before you get there, and then you get in and you have no choice. You have to take what they give you. Freedom of choice is very limited at that moment. And so it's not only because the uptake is high, it's also the system you are using. So I'm a big fan of private systems as we have it in Belgium, where there is a fixed reimbursement, you have a selection, you have a choice, there is availability of solutions for people who have lower financial needs, fine, but you have a choice. It's you to say, because it's so important that people feel that this is really tailored to what they need and they will use. And I think that's good. And we see that the higher the level of satisfaction with the services, then we see also that the satisfaction and the use per day is higher. So that is also one trend. So how the system works. On the other hand, we do know that if people with very mild hearing loss start using hearing aids, that it's likely that they may use them more selectively. And that makes sense. They may use them in situations where there's a challenge. But the observation is correct, and that's also what you will find in getting the numbers right, because we do see that trend, and that the way the system is working really makes a difference at that moment. On the other hand, Switzerland is scoring quite high on uptake, but is also scoring very high on satisfaction. So it's not a contradiction in terminis, but we need to be careful that we maintain good quality, and then we provide person-centered care when we are using hearing aid fitting. And I'm sure that, as we do at Thomas More, but I'm sure all audiology settings are really focusing a lot on person-centered care, ensuring that people get the solution that works for them, supporting them in a good way. So at that moment, we make sure that they use them frequently, the hearing aids, and satisfaction is higher. So let's try in Belgium to mix the best of both worlds, increase uptake, but also make sure that satisfaction is high and efficiency is good.
Yeah, thanks a lot. It's clear. And maybe I have another question for you. You showed us that the satisfaction of hearing aid user in Belgium is quite high. And do you think that there is a role of the double check of the ENT after the fitting? I don't know how does it work in the other countries, but do you think it can be a part of the answer? Yeah.
What I think makes a difference, in Belgium, you need the mandatory diagnostics for everybody. And in Belgium, we see that ENTs are strong allies. We both work, the ENT professionals, the ENT surgeons and us, are both going to find the best solution for the user. So I think it's very important that audiologists are well-trained, well-educated to deserve the trust of the ENT. But it's also important that we maintain very good relations, because the ENT is the gatekeeper of promoting and informing the users and people with hearing loss that they can go for hearing aids. So I think it's important that we have good ties. So yes, the good relation between both is good. I think it's important to be empowered at that moment. So I think cooperating very well with our professions is so key for success at that moment. And the involvement, you may remember that when we were writing the royal decree for audiology, that our professionals insisted the mandatory diagnostics of the ENT before fitting hearing aids. And the reason was that it's much better to have good relations and good ties, that we both feel that we have to do something about better hearing care, instead of saying, well, let's do it on our own and there's no need to work with an ENT. I think it's important to maintain good relations.
Perfect. Thanks a lot, Mark. So I think there are no other questions for the moment. So maybe I can close the session now for this evening. And I just would like to leave the floor for Dominique Jaspers.
Dear participants, on behalf of UCBA CEUPA, we would like to sincerely thank you for your interest in and participation in this EuroTrak webinar. A special word of thanks goes to our two guest speakers, Dr. Zimmer and Mr. Lorenz, as well as to our moderator, Dr. Dussen, for their clear and inspiring contributions. We hope you found the webinar interesting and inspiring. I wish you all a pleasant evening, and we look forward to welcoming you again at a future event. Thank you.
Thank you.